Hello, massage nurse. Today I'm going to be talking about the cardiovascular pathologies. I will be talking about anemia, angina pectoris, atherosclerosis, congestive heart failure, coronary artery disease, and deep vein thrombosis. So let's start with anemia, and there are different types, some that are not as dangerous and some of them that are. So let me remind you again that anything with anemia has to do with the blood, because blood is what carries oxygen to your tissues, to your brain, to every cell in your body. So anemia is the reduction of the quantity and quality of either the red blood cells or the hemoglobin. And red blood cells carry hemoglobin, which is the oxygen. The red cells are formed in the bone marrow, the red bone marrow. And once they leave the bone, they lose their nucleus. And the reason they lose their nucleus is to create more surface area to carry the hemoglobin. So it makes them very floppy too. You know, they look like a little floppy disk, flexible enough that they can fold in half to go in through the capillaries, because the capillaries are very, very tiny. So red blood cells, carry oxygen throughout all your body. The lifespan of a red blood cell is like 120 days, and once they start falling apart, they go to the spleen to get recycled. So let me talk about the different types of anemia. The least dangerous one is the nutrition anemia. Actually, 3.5 million of Americans at one time or another have anemia, and that's usually the one where the doctors give you an iron deficiency tablet and tell you to eat more beans and more spinach and anything that's high in iron. Another deficiency would be the folic acid or pernicious anemia. Those two are vitamin B deficiency. Pernicious is vitamin B12 in specific, and the other one I think is vitamin B3, the folic acid. Now the more dangerous one is the sickle cell anemia, and that sickle cell anemia is hereditary. Children are born with it. They get it from their parents, and this is where the red blood cells look like sickles. They have real jagged edges. They're not soft and pliable, and these sickles get stuck. They can't pass through the capillaries and and through your cells. So this is more dangerous. There's no cure for it. So make sure that when your client comes in that you do a good medical history. Then they will tell you. Most clients, when they do have something, they do let you know. So just find out which one it is. Oh, aplastic anemia is where your red bone marrow is not producing any, blood cell, red or white blood cells. So that's also a dangerous one. If they have the regular anemia, nutrition anemia, there's really no contraindications for the massage. With the other ones, there might be, because they feel more, they can feel lightheaded, very fatigued, just exhausted. They might not be able to lay either completely flat, supine, or in the headrest, with their head, down. You might need to lift the headrest a little bit. So just make sure to do a good medical history and accommodate to your client's needs. And like I said, if it's just a normal nutrition anemia, there's really not a lot of precautions that you need to take. So next would be angina pectoris, which is chest pain from the temporary blood flow to the heart. These people, there's different types, and some of them, the mild one can be triggered by emotional stress or exertion. Somebody that's been working out, or a sudden drop in also in temperature can cause it. And acute coronary syndrome, that's a little bit worse. That often signals myocardial infarction, which is another fancy name for a heart attack. And usually people with this type of condition, they carry the nitroglycerin, where they can put it under their tongue. Nitroglycerin is a vasodilator, so that it opens up their arteries and the blood flow to get more blood flow to their brain and to their cells. So sometimes, it's spasms of the coronary arteries. So it spasms and it triggers pain. So there's also a muscle, right here where a lot of people might think they're having, angina, but it's really, the pectoralis, right around this area that. So find out, make sure. A lot of times it's nothing. However, if they have been diagnosed by a doctor, it can be pretty scary. So I'm not trying to scare you, but just find out. Next is the atherosclerosis, and that's plaque within the arteries that restrict the blood flow, and it can, block the veins and arteries, and it can cause blood clots. It's usually associated with high blood pressure and related to other diseases like diabetes, like angina pectoris. So, you want to, again, ask your client for their, in their medical history and how they're feeling like that day. Usually these massages are tailored to the client, and it's usually a 3 out of 10 in pressure, depending, like I said. If they're being treated by a doctor and they have no symptoms at the time, then you can go ahead and give them a normal, regular massage. But if they're having any issues, make sure you find out exactly what it is. So the next one is congestive heart failure, and that's the heart's inability to pump blood through your whole body system. Their heart is weak. And I'll remind you guys again, the heart is a muscle, just like your biceps, your triceps, your rectus abdominis. You want to work it out. This is where, exercise is cardio exercise is important to get your heart pumping, to get it to be strong for when you need it, so it can pump blood throughout your system. Congestive heart failure is a syndrome associated with all other diseases too, like high blood pressure, diabetes. If they've had a previous heart attack, they're usually on medication associated with chronic obstructive pulmonary disease also. So you want to make sure and find out if that day they're fatigued and they're not feeling well. You might want to postpone the massage. I did have a client that had the congestive heart failure, and he just really wanted massage on his back. And that was great because it really made him feel more comfortable. It didn't tax his body so much because his was pretty advanced. So, it just depends on your client. And if they're not feeling well, guys, it's better to postpone the massage than to have a chance of them, really feeling awful on your table. And that can be, like I said, kind of scary. So the next is coronary artery disease, and that's the atherosclerosis in the actual plaque in the coronary arteries. So your heart has its own blood flow. Your heart has its own arteries. So, that supplies just the heart, not all over your body, but supplies just the heart. So coronary artery disease is the plaque inside those arteries of the heart. And they have, they narrow, and they can create backflow, to the heart, especially the left ventricle. The left ventricle is the one that pumps the blood to the aorta, so that the aorta can carry the oxygenated blood all through your system. Remember, arteries carry oxygenated blood, and veins carry deoxygenated blood back to the heart. So the left ventricle is affected a lot of times with a coronary artery disease, and it's just backflows, and it starts backflowing sometimes into your liver, the blood into your liver, and into your lungs. So it can create ischemia. Remember, ischemia is a lack of blood flow to the area, so it can have scarring, and it's like I said, these are medical diagnoses. Your client will know they have it when they come in, and you treat it the same way as any of the other ones. Usually you want to give a massage like a 3 out of 10 if they're having, if they're not feeling well. Otherwise, if they give you the okay, and they have the okay from the doctor to get a regular massage, then you can proceed with that. all of these, one of the benefits of massage is that it reduces anxiety. It reduces, their blood pressure. If they have a lot of these are affected by high blood pressure. So massage reduces the blood pressure, and it also, slows down the sympathetic nervous system. So they go more into a rest and digest parasympathetic nervous system. It stimulates that. So massage is very beneficial to all of this. Okay, deep vein thrombosis. This is inflammation of the vein, and if you guys remember from studying the cardiovascular system, is veins have one-way valves, because veins are carrying deoxygenated blood to the right atrium and the right ventricle, and then to the pulmonary system to drop off the carbon dioxide and pick up oxygen, and then take it to the left atrium and then left ventricle, and from the left ventricle to the aorta. So veins, the deep vein thrombosis creates inflammation within the vein. Usually, along like the valves, the little valves that prevent the blood from, flowing back down, just to keep it from backflow. And a lot of times these form clots. It attracts inflammation, attracts platelets. And so these create blood clots. And one of the contraindications for massage is if they do have a blood clot, and you'll be able to tell if there's a lot of pain, if there's redness, if there's swelling and inflammation, and you want to stay away from that area. And if they do have severe pain and it's very hot to the touch, they usually happen on the legs. More common are on the legs, blood clots do, and you don't want to dislodge that with a massage. So that's a contraindication. You do not give them a massage. You refer them to their doctor, because if you dislodge that that blood clot, it could go to to their lungs. So you don't want to do that. And another thing is they might be on blood thinners. People that have previous that have deep vein thrombosis, they usually are on blood thinners, so they bruise easier. You want to make sure and find out what medications, with all of them, you want to make sure, find out what medications they're on, because even baby aspirin is a blood thinner. So if they are on a blood thinner, you want to go lighter. Again, a 3 out of a 10, especially on their limbs. And blood clots, I remember many years ago, I used to think blood clots were round, like a little round, like a pea size or something. And no, blood clots are the form of the vein, so they can be long, they can feel long, the size and shape of a vein. So be careful with a deep vein thrombosis, because that is inflammation of the veins. And as a matter of fact, varicose veins, I'm surprised it's not up here, but varicose veins is they lost the elasticity of the little valves, so the blood starts pooling, and that's like a little pool of blood, where you can see in varicose veins how it looks like they're deformed, and they're very blue around that area. Varicose veins is nothing more that the little valve that used to close does not close anymore. It's lost its flexibility. It happens a lot with people that stand up for long periods of time, or or are very overweight, or with women that are pregnant that put that extra pressure on their legs. So I just gave you a freebie one, varicose veins, that's not up here. So anyway, this is the first part of the cardiovascular diseases, and I will have part 2 the next time, and I'm just breaking them apart when there's too many in one. And some of them don't. Some of them have very few pathologies, but these are all the pathologies to the cardiovascular system, part 1. Part 2 is to follow. Until the next time, create a great day.